Hi, my name is Jessica Young, and my presentation for HPR 2120 is on fetal alcohol syndrome.
Fetal alcohol syndrome is also known as FAS. FAS is the term I'll use throughout this presentation. FAS is a congenital syndrome caused by excessive consumption of alcohol by the mother during pregnancy, characterized by delay of mental development and of physical growth, mainly of the skull and face of the infant. FAS is the most involved end of the fetal alcohol spectrum disorder, FASD. Fetal death is the most extreme outcome from drinking alcohol during pregnancy, but is not always the case. The picture to the left shows the harsh reality of what happens when the mother consumes alcohol. It goes right to the baby. There are many characteristics of fetal alcohol syndrome. The physical characteristics are small head, smooth ridge between the upper lip and the nose, small and wide-set eyes, thin upper lip, or other abnormal facial features, below average height and weight, hyperactivity, lack of focus, and poor coordination. Intellectually, the parts of the brain that are affected is the corpus callosum, which processes information between the right and left brain, cerebellum, which is motor control, basal ganglia, which processes memory, hippocampus, which is learning and memory, hypothalamus, controls appetite, emotions, and temperature and pain sensation, the frontal lobes, which control executive functions, impulse control, and judgment. Learning problems. First, establish the child's strengths and weaknesses, review reports and assessments from people involved in the child's learning, and talk with parents for background information. The child will need the same support and guidance given to other learning and behavioral disabled children in the classroom. Lesson plans and study skills are not as important as setting up behavior plans for the child, with a lot of positive feedback and a reward system. Patience and empathy, a stable environment, and consistency with rules and expectations are a basis for working with FASD affected children. The fact that there is no cure makes a teacher's support and understanding even more crucial. This slide talking about symptoms goes in a little more detail from the slide before of the characteristics. The symptoms are any mix of physical defects, intellectual or cognitive disabilities, and problems functioning and coping with daily life. The physical defects, which there's a picture on the right to show those, small eyes, thin upper lip, short upturned nose, smooth skin surface between nose and upper lip, deformities of joints, limbs, and fingers, vision or hearing problems, small head circumference and brain size. The brain and CNS problems, there's poor coordination or balance, intellectual disability, learning disorders and delayed development, poor memory, trouble with attention and processing information, difficulty with reasoning and problem solving, jitteriness or hyperactivity. Social and behavioral issues include poor concept of time, problems staying on task, trouble getting along with others, poor social skills, trouble adapting to change or switching from one task to another, and problems with behavior and impulse control. The cause of fetal alcohol syndrome is consuming alcohol of any kind while pregnant. Fetal alcohol syndrome is 100% preventable. Do not drink alcohol while trying to get pregnant. Avoid alcohol through the pregnancy. Consider giving up alcohol through childbearing years. And if a woman has an alcohol problem, they should seek help before trying to get pregnant. As I just said, FAS is 100% preventable. It is the leading preventable cause of mental retardation. Alcohol during pregnancy causes permanent brain damage. There is no safe level of alcohol consumption during pregnancy. Even one drink risks the health of an unborn baby. FAS is a lifelong, invisible, and irreversible disability. Symptoms may not become obvious until a child is 3 or 4 years old. FAS is found in all races and all socioeconomic groups. There is no cure for FAS. Lifetime cost for one individual with FAS is estimated to be around $2 million. 20 to 50% of women in the U.S. reported drinking while pregnant. When working with people with FAS, the modifications that need to be made are the following. First off, you need to cut the child's age in half. This is the age they'll most likely act. You need to be patient, reteach everything over and over, keep the child on a routine if possible, and keep blood sugar stable. A fluctuating BP causes mood changes. Here is an example of a developmental age equivalent for a child with FAS. If their actual age is 18 years old, their expressive language will seem of that of a 20-year-old. Their comprehension will seem of a 6-year-old. Money and time concepts are that of an 8-year-old. Emotional maturity seems of a 6-year-old. Physical maturity, about an 18-year-old. Reading ability will make them seem about 16 years old. Their social skills makes them seem about 7 years old. Living skills are about 11 years old. So as you can see, this is why it would be difficult for a teacher or parent to work with one with FAS. They are all over the board, and it is a wide spectrum of what they are able and unable to do. Some women may be unaware of the effects alcohol may have on their unborn baby. Unfortunately, there is no treatment for a child with FAS. However, early intervention services may help reduce some effects and secondary disabilities. Intervention services include a team of special education teachers, speech therapists, physical and occupational therapists. They may need help with walking, talking, and their social skills. There are some medications to help with some symptoms, and there's also vocational and life training skills to help them cope into the real world. Hopefully you guys have been paying attention, because my first activity are review questions. The first question is a true and false, and it is, having a slight amount of alcohol is okay while pregnant. Number 2 is, when do symptoms of FAS usually become visible? And the third one is, what areas of the brain does FAS affect? There are multiple parts. Make sure you list all of them. The second activity I'm going to have you guys do is a memory game. Go to the website below and complete the game, and I'd like you to write down how long it takes you to complete the game in the discussion. The reason you are taking this is to understand what a person with FAS has to go through daily and the activities they have to complete to improve their memory skills. If you or someone you know is trying to get pregnant or is pregnant, please talk to them and remind them that having any alcohol while pregnant, any at all, can cause problems to their unborn baby. There are resources available to help women and families and teachers through this disability. So some of the resources for fetal alcohol spectrum disorders is American Academy of Pediatrics Fetal Alcohol Spectrum Disorders Program, Centers for Disease Control and Prevention, National Organization on Fetal Alcohol Syndrome, which also contains resources for teachers. There is National Organization on Fetal Alcohol Syndrome, Fetal Alcohol Spectrum Disorders, Centers for Excellence, Families Moving Forward Program, FAFASD, Great Lakes FASD Regional Training Center, and FASD Trust. I hope you guys enjoyed my presentation and you learned a lot. Like I said, please make sure that any woman who is pregnant is not drinking. Get help if they are. These are my references. Thank you.